What are root canals? The important structures of a tooth are crown, root, enamel, dentin, pulp, and cementum. The pulp is present inside pulp chambers and root canals. The chamber enclosing pulp is called the root canal. What is root canal treatment? Root canal treatment means complete removal of infected pulp tissues from the pulp chambers and root canals and filling the spaces with medicaments so that you can avoid needless extraction and other related complications. Who needs root canal treatment? People with severe tooth decay, infected tooth with abscess, cyst, fractured tooth, non-vital tooth, and preparatory to other procedures like fixed partial denture placement. Why should we treat such conditions? Once the tooth gets infected, there is severe microbial attack on the pulp by bacteria. Since the pulp is enclosed in a chamber, the inflammatory exudate produced will not be able to escape, and they produce severe pressure on pulp tissues and hence severe pain. Toxins are released into the surrounding bone, breaking down of supporting tissues. Spread of infection, development of abscess, and erosion of bone tissue occurs. Even sudden and serious swelling in neck and face appears. This can be treated only by the removal of infected pulp tissues so that the tooth can be saved and preserved for your whole life. Treatment procedures. Clinical history is noted. Oral examination is carried out. X-ray is taken to find out the extent of decay. Local anesthesia, if required, is given. Access opening is made in the crown to reach the pulp chamber and pulp. The infected pulp and toxins are removed from the chamber and canals. Cleaning, shaping and filing of canal is carried out. Canal is dried with paper cones. Medication of pulp chamber is done to take care of infection. In case of severe infection, medication can be prescribed. Canal is filled with gutta percha cones and medicated pastes. A temporary filling is first given. Then a permanent filling is done. A crown is made in order to protect and re-establish original form and function. If the tooth is destroyed severely by caries, then a post and core can be constructed over which the crown can be placed. What happens if crown is not given on a tooth which has undergone root canal treatment? If crown is not given on a tooth in which root canal treatment is carried out, it may result in the fracture of the tooth due to heavy masticatory or chewing forces. So, it is a must to give the tooth a crown to establish the original form and function. Number of visits. Usually, it takes about 3 sittings to complete root canal treatment. What should you do after the treatment? You should avoid chewing hard things with the tooth that has undergone root canal treatment. Should maintain oral hygiene by brushing and flossing. There will be a mild discomfort, but that can be controlled by painkillers. The advantages of root canal treatment. Simple but very effective procedures. Prevents extraction and related complications. The success rate is more than 95%. Natural tooth is preserved, and a replaced tooth can never be as perfect as a natural tooth. Disadvantages. Some tooth will have an accessory canal, or their roots may be severely curved or can have very narrow root canals. These will lead to failure of treatment, which is characterized by return of pain and swelling. What if RCT fails? There are 3 options. First, repeat the whole procedure of treatment. Second is to carry out apicectomy. In this procedure, the tip of the root is surgically removed. This is usually done when there is a lesion or cyst at the root tips, or when it is not possible to get a good seat at the root apex by conventional RCT methods. And the last option is extraction. What will be the life of a treated tooth? If oral hygiene is maintained properly and instructions are followed strictly, then the tooth will last the whole life. What will be the expenses? It is worth to spend some money to preserve a natural tooth. An artificial tooth, which is more expensive than a root canal treatment, can only be a substitute for a natural tooth, but never can it be as perfect as a natural tooth. Home care. It is very important to brush and floss regularly. Try to avoid hard, sticky foods and visit your dentist regularly. What is the success rate? It is found to be more than 95%. Is there any alternative to root canal treatment? The only alternative to root canal treatment is extraction. Here, natural tooth is lost and a space will be created. If the space is not treated with removable partial denture or fixed partial denture or implants, the neighboring teeth and opposing tooth will move towards the created space and may result in unwanted, undesired movement, which is a complication. If you are replacing the lost tooth with partial dentures or implant, they are costlier than root canal treatment. So the best choice is root canal treatment. In short, nothing in the universe is as perfect as a natural one. So, try to preserve it rather than substituting it if you have a choice.